The primary audience is people in healthcare who are new to lean, and there are still people today who are just discovering lean or just starting to practice lean in their organizations. So the book is read by hospital executives, physicians, nurses, people in process improvement roles. And I think there's always been a secondary audience for the book, people who know lean but are moving into healthcare. There are a lot of people with backgrounds in engineering or manufacturing or business who already know lean, but they are new to healthcare. The book gives them examples. I know a number of people who have read the book in advance of going and doing job interviews, as part of their shift into healthcare. There's a number of things that are new with the book. One is just trying to reflect a little bit of the context of an era of healthcare reform and the Affordable Care Act. We didn't change the title of the book, but there's a little bit more of a focus on health systems as opposed to just more narrow focus in hospitals. With the book, having the chance to really look at it from scratch, you go through and try to clarify parts of the book and just make the book and the explanation of lean concepts more clear. So there's kind of editing and revision all throughout the book, and that includes revised data, updated case studies from organizations that were in the second edition, new examples and stories to help illustrate lean principles. So that's some of the new content. There's a new chapter on lean design, looking at what healthcare organizations are doing to work with their architects and their staff in the design and construction of space that serves everybody better. A number of discussions and quotes and stories from executives from various organizations, from some different parts of THEDAS, UMass, Eric Dixon, their CEO, and some of their story about why lean was strategically important. Updated case studies and quotes from executives at Avera McKinnon Hospital in South Dakota, the Baylor Scott and White system in Texas. So there's new stories, more stories to try to help illustrate lean concepts. The book Lean Hospitals, I think, addresses most every part of that transformation house. The book talks about the idea of customer value, and there's a chapter that talks about the idea of value being defined by the customer. In this case, in healthcare, we mean the patient. Understanding the difference between value and waste. That's, I think, fairly clearly explained in the book. The leadership behaviors. There is a specific chapter in the book on engaging and leading employees, but I think there's a common theme throughout the book about the importance of leadership at all levels in the organization. That lean is not just for the frontline staff. It's not just about training and tools. It's about a management system and a lean culture that we would recognize in various industries. The book talks about problem solving, root cause problem solving, to solve what have been a lot of really nagging problems in healthcare. Instead of people fighting the same fires every day, identifying risks and opportunities to improve, to prevent harm to patients, for example, which I think is the most compelling and important goal with lean in healthcare. And the book also covers a lot of the foundations and the philosophy of lean and the Toyota production system. And when the book discusses tools, I've tried to do so in the context of how those tools are born from lean principles.